Hello, this is Dr. David Greene, CEO of the Mid-Atlantic Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought for that back pain, 90% of it gets better within 6 to 12 weeks, thankfully. Unfortunately, a few of us will end up with chronic back pain. The definition of acute back pain is 6 weeks or less. Subacute is 6 to 12 weeks. Anything over 3 months is defined as chronic back pain. It's the second most common reason for doctor visits. Half of all working Americans admit to having back pain every year. It's the most common cause of worldwide disability, and it's the direct and indirect cost of it is $100 billion a year in just the U.S. So let's go through the causes of back pain. There are soft tissue causes and there are hard tissue bone causes. So the most common soft tissue is back sprain or strain by far. Moving injury, weekend warrior activity. It could just be from a sneeze if you already have a degenerative disc and that kind of causes a tear. When you start talking about a disc cause, you're looking at the normal disc here on the left. The outer layer is called the annulus, which is harder than the inner gelatinous layer called the nucleus. There is no pain on the inner aspect. There's no nerve endings there. The nerve endings are out here in the annulus. Okay? So here you see a healthy disc. Here you see a compressed disc and a little bit of a bulge back there. It can get so compressed that it almost fuses itself to the level above. So a bulging disc could be when you have degeneration and you start to lose water in the disc. Basically, it turns into a tire that's starting to get flat. You know how it bulges out? Well, that's what can happen, okay? Now, if you start to get tears in the outer part, remember this is called the annulus, that can be painful because there are nerve endings out here. If this tear goes all the way through and a disc squeezes out, that's called the disc herniation. And that can push on a nerve root and cause not only back pain, but also leg pain because it pinches that nerve root and the pain goes down the leg. Here's a cartoon view of sciatica. You have 3 nerve roots that come together that create the sciatic nerve. If one of those is getting pinched, pain can go down the back or the side of the leg in wherever the distribution of that nerve root goes to for sensation. Okay? Here's a bulging disc. See how there's no tear in the outer layer? That in and of itself can be large enough to pinch on a nerve root. Okay? Here you see a herniated disc coming backwards, pinching on a nerve root, and causing sciatica. Now, when you start looking at the bony causes of back pain, far and away, number one cause is arthritis. There's joints in the back of the spine called the facet joints. If they get arthritic, they can become painful just like any other joint in the body, an arthritic hip or a knee. Okay? SI joint pain, there are 2 SI joints in your lower back, one on this side, one on the other. It's where the sacrum matches up with the pelvis. That's the SI joint. 15 to 25% of back pain comes from pain in the SI joint. Scoliosis occurs due to degeneration as one ages. Arthritis is typically not symmetric, so if one side breaks down more than the other, you can end up with a curve in adulthood. Spondylolisthesis is due to degeneration. You can end up getting one level of vertebrae slipping on the one below it. Listhesis means slippage. Spondy means spine, so basically you end up getting slippage of one level above the other. When you pulls forward, it actually pulls the nerve root, which would be coming out right here with it, so it can cause not only back pain from arthritis, but also leg pain from pulling on that nerve root. Spondylolysis refers to a stress fracture of the spine. This is the fracture here. All right, it's an area called the pars. And when the pars gets a stress fracture, that can lead to back pain. It's common in gymnasts, football players, folks who are in their adolescent years, college athletes. Spinal stenosis is when you get arthritis, overgrowth of bone, and soft tissue as well, and it can pinch nerve roots as they try and get out from the spinal canal. Okay? That spinal stenosis usually occurs at multiple levels at one time. It can be very painful. Uncommon causes of back pain include infection, fracture, such as you see here, compression fracture. It's not as uncommon as you might think. About 1 million of these occur each year in the United States, compression fractures due to osteoporosis. Now, you can also get a tumor. That's much less common. The top non-operative pain management for all these acute and chronic back pains are available through the Mid-Atlantic Pain Network. There are many clinics available throughout the Mid-Atlantic region, Maryland, Virginia, surrounding areas. Over 50 insurances are accepted and over 25 treatment options are provided by the board-certified, award-winning doctors. Visit us online today at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Greene with the Mid-Atlantic Pain Network. Your pain stops here.